Okay, we're here with Leni, 4 weeks down in her third year clinical rotation here from Long Island University, and she's going to talk about what she learned this week, her big aha take-home moment.
All right, so this week, or the last couple of weeks, I've been working on the NFTs and palpations, and so getting to experience what I've seen Rhett and heard Rhett do and talk about. So actually feeling a muscle that is totally inhibited or very weak is very cool to target one specific muscle, and you know that that's where they're compensating from, or where they're using other muscles to compensate for, and then using your palpations to activate that muscle, and then within a matter of seconds feel a significant difference between that totally inhibited muscle to a muscle that can now contract, and potentially with a really strong contraction even, and then seeing them be able to function better in their post-screen. They have less pain and often are moving better. It was really cool.
So you mentioned how cool it is for you to experience inhibition, facilitation, how fast it is. Talk about the expressions and the feedback that you get from the patient when that happens.
All right, so a lot of patients that come in here, often I've heard them talk about Rhett's voodoo. So they're just really in awe of how quickly or how much of a difference they can feel a muscle that they are working so hard to try to contract and just can't do it, to then being able to feel strong in doing that exact same contraction just seconds later. And often have never had that feeling before or experience.
Yep. Okay, and now talk about, so did you learn NFTs in school?
No.
Nope.
No NFTs.
So NFT stands for neuromuscular facilitation test. So we're testing neuromuscular facilitation, whether it's inhibited or facilitated, not whether it's weak or strong. So talk about the difference between a manual muscle test and a neuromuscular facilitation test.
So neuromuscular facilitation test, you're looking to see that the muscle can contract and withstand a contraction, as opposed to a manual muscle test where you're just pushing on the patient into a certain position. You're not focusing on one specific muscle oftentimes, and you're looking to see how strong that muscle is, as opposed to its ability to just contract.
Okay. And when you learned a manual muscle test in school, was that relatively easy to figure out?
Yeah.
Okay.
Yep.
And learning the NFTs, how many days has it taken to get used to the appropriate amount of pressure?
It's taken me a lot of days. It definitely requires a lot more finesse and technique to do NFTs than it does an MMT.
Yep, and she's no different than any other student and the students that come through a lab weekend. So this takes a while to break the habit of doing break tests for gross strength and facilitation tests, which she just mentioned are very specific, and it's your feeling for the giving out or the contraction versus gross strength. So a huge difference that takes students a while to get used to. All right, so there's your take-home message. NFTs, palpation, how easy, how fast, how effective it is, and how you feel as the practitioner testing that and getting an immediate result, and how the patient feels on the other end saying, wow, what the hell did you just do to me?
Yep.
All right, we'll see you next week.